my name is Ashley. I'm going to be your nurse today. Can you tell me your name?
Mallory.
And how old are you?
26.
Okay, so today you're just in for a head-to-toe assessment. Going to be listening and touching different areas. Doesn't mean anything's wrong. Just want to make sure that we're doing a thorough head-to-toe assessment. Do you have any questions before we get started?
No.
Okay, well, during the exam, if you have any questions, just stop me and ask me. So the first thing, I just want to ask you a couple questions. So do you know who the president is?
It's Donald Trump.
Okay, and do you have access to 3 meals a day?
Yes.
Okay, and so just looking at you sitting right here, your posture looks good. And I noticed that when you walked in, your gait looked good. You weren't using any like devices like a walker, a cane. Do you use any of that at home?
No.
Okay, and then we did your weight when you came in. Your BMI with your height and weight was in the normal range. Also, have you been feeling pretty good?
Yes.
Okay, and you feel happy most of the days?
Yes.
Okay, and then is English your natural language?
Yes.
Okay, and then so just, like I said before, everything looks good. You look clean. Don't look dirty or anything like that. Your appearance looks good. So that concludes your head-to-toe assessment. Okay, so gonna give report on a 29-year-old female who came in for a head-to-toe assessment. We started off just by asking her some questions. She was alert and oriented ×3. She had great nutritional status. She had good posture. Her BMI was appropriate with her height and her weight. When she walked in, I could tell that she had good gait. She wasn't using any devices like a walker or a cane. There were no physical deformities. She was in a good mood. She stated that she's happy, that she stays in a good mood. Her natural language is English, and she was nice and clean. Then we went down and started on her skin. Her hair was good. She had good color. It was appropriate for her race, like her hair distribution on like her arms. That's what I mean. The color was good. She was warm and dry to touch. Her capillary refills were less than 2 seconds. We did peripheral pulses, which were her radial and her brachial pulses. They were good when we palpated them. Her nail beds and her hands, they were clean. So then we moved down to her head. We checked her scalp. It was nice and clean. There was no redness. I didn't notice any dandruff. Her hair is blonde. She didn't, it was clean. She denied any tenderness to palpations. There was no lumps, bumps, or bruises, in her neck or anything like that. I moved down to her face. Her face was nice and symmetrical. We did cranial nerves 1 through 12. They were all intact. Her temporal arteries were palpated. There was no thrills noted. She denied any tenderness to her maxillary and frontal sinuses. Then we went to her neck. It was negative for any like palpations. There was no lumps, bumps, or bruises. She denied tenderness when we did palpation of the trachea and the neck. The trachea was midline. We palpated her lymph nodes. There was no tenderness. There was no swelling. There was no enlargement. I checked her carotid arteries. We did inspection. There was no lumps, bumps, or bruises or thrills to palpation. We did them one at a time. They were palpable in auscultation. We did both bilateral sides where there were no murmurs and there were no thrills. I also checked her cranial nerve number 11, which is her range of motion her range of motion in her muscle in her neck. She had good range of motion. She had good muscle strength in her neck. I moved down to her eyes. Her external structures were clear of irritation. Her eyebrows and her eyelashes and her eyelids. They were clean. Her conjunctiva was nice and pink. Her pupillary reaction was equal and reactive to light and accommodating. The sclera was white. Her iris was blue. Her cornea was assessed from the side. It was round and non-concave. I moved to her ears. The external ears didn't have any like drainage or irritation. She denied any tenderness to palpation. Her nose was midline. She had good patency in both nostrils. There was no drainage. The mucosa was pink. The septum was midline. We moved down to her lips. There wasn't any crack, no irritation. They weren't cracked. I didn't notice any like fever blisters. There was no lesions. The mucosa on the teeth, the gums, the tongue, the soft palate, the hard palate, and the tonsils, they were all moist with no exudate. We moved down to her thyroid. It was palpated. No tenderness. It was not enlarged. We moved down to the lungs. We did posterior inspection, which was AP to T diameter. On the scapula and the spine were midline. We did anterior inspection. There was no use of any of her accessory muscles. We counted her respirations. They were 16. The lungs were clear to auscultation on all 4 lobes, which for the anterior and the posterior also. Also checked her CVA tenderness. When I was doing her posterior, it was negative for CVA tenderness. She denies any tenderness on palpation. Then we moved down to heart sounds. We did sitting and lying. They were auscultated. There was no murmurs, no thrills. The S1 and S2 were heard. We also palpated the apical pulse at the 5th intercostal space on the left side by her mitral valve. We moved down to the abdomen. I did inspection at eye level. She had good contour. It was nice and flat. The color was appropriate for her race. There was no scars. It was symmetrical. There was no striae, no visible peristalsis or pulsations noted. Her umbilicus was midline. We did bowel sounds. They were present in all 4 quadrants. We did tympany to percussion to all lobes. It was negative to light and deep palpation to all lobes. Then we moved down to her lower extremities. We started with the skin. She had good hair distribution, good color. It was warm and dry. There was no edema noted. I didn't notice any varicose veins. We also did peripheral pulses in the lower extremities, which were her femoral, popliteal, her posterior tibia, and her dorsalis pedis. We did full upper range of motion on the upper and the lower limbs, and she had good muscle strength in those. She also had a good hand grip when I asked her to grip my hands. We also did a heel to shin test. It was negative. We did a patellar reflex. It was positive at 1+. And then we also made her stand up. We did a scoliosis test, had her bend over, make sure that her spine was straight, and it was. So it was negative for scoliosis.